it was surprising to me that there isn't a central, focused standard of care, someplace you can look and say, look, I've got this kind of an ulcer, here's what everybody in this field as a consensus panel recommends. Should there be? Should there be standardization for wound care? And what guidelines are there out there, and what do you like?
There should be standardization.
There
absolutely should be. And here's the good news. They're there.
They're
out
there.
They're out there.
Where? Where?
The centers of excellence, the wound care centers, the home care agencies, the risk groups that manage these particular patients effectively. But how the challenge is there isn't. Let me back up and see if I can clarify it a little more.
Because
it's
if
there,
you say they're there and I go look for them and I can't find them, they're effectively not there.
It's there because treating chronic conditions, the mechanisms for doing that in our healthcare delivery system is well established. The only thing that hasn't been plugged into that as a skin, let's say, is wound care.
Okay.
Chronic wound care has not been treated that way. So if we were able to carve it out as an entity, the centers of excellence and the protocols that are established by doctors like Dr. Snyder and his center, care centers all over the country, once those are aggregated and plugged into a delivery system that is accessible to the provider and the caregiver, you can, with the staffing of the health plan and the payer groups that are integrated into that care continuum, it exists. It's all out there.
Yeah, well, wait. Let me parse that out again. It was a very quick answer to say they're there. But then you went on to say why it's probably not easy to find it and why it's not there. And so,
There's no quarterback.
Right. If a plan exists in a forest, but nobody can access it, does it exist?
You know, it is accessible. It is something that is available to everyone, particularly with the internet, et cetera. One of the main reasons, besides the economic drivers, that hospitals coordinate with companies that will manage their centers is one of those components is they will supply appropriate algorithms that are evidence-based so they can train those physicians working and clinicians of all kinds working in those centers to try to stay within those guidelines. Now remember, guidelines are nothing more than guides. They're not sine qua nons, and every patient is different. Additionally, many different clinicians are transitioning to wound management from other fields. And they have been treating wounds in a particular way for 20 years. It's very difficult to retrain those individuals to the appropriate protocols.
You get back to, damn it, Jim, I'm a doctor, and I know what I'm doing, Jim.
I've done it this way for 20 years, and I'm going to continue. I understand what you're saying, but this is the way I treat it.
But walk me through this for a second, because I really want to parse this out. I know what you said. I know that you said that if you look for it and if you think about it, there is a way to approach these things.
Well, from a practical perspective, if Dr. Snyder has a vast experience in treating wounds. He's treated tens of thousands of diabetic wound care patients. When one walks into his facility, he has a very good idea after doing his appropriate evaluation on how that patient's going to respond to the treatment he recommends, his protocols. The challenge is the primary care physician that's going to see that patient in 2 weeks doesn't.
That's my point.
However, if there were a risk-bearing entity that carved wound care out as a chronic condition, could access those protocols with technological, and this is sort of a future look, but it can be done because it was done.
Yeah, but again, future look, subjunctive tense. Right now, I'm Joe Doc or Jane Doc. Someone comes into my office and I really want to do this right. There is a wound, I want to pay attention to it. I had the patient take his shoes and socks off, and I see this wound. I'm looking for the path, and I want a codified, easy to find protocol. Can I find it?
You can find it, but my opinion is that if a doctor who does not have an expertise in wound management, particularly in the diabetic population, then that patient should be referred. This is my own opinion.
Not everybody's going to be referable to a wound center?
Not necessarily a wound center, but perhaps someone in your community that has more of an expertise in that area.
And I think what you're getting at versus what they're referring to is they're suggesting, and correct me if I'm wrong, but you're suggesting that at these centers of excellence, they have established themselves a protocol that works for them.
Correct.
But I think what you're getting at is that protocol is not supported by a society and placed out there for acceptance for all practicing physicians in different fields.
I feel so much better now.
Right?
Yes. In
Like
other words,
there's
I know
not
you guys
an
know what you're doing.
American
but-
Academy
So
of
there's a
Wound Care.
company out there that was founded some time ago that did exactly that.
Okay.
We worked with the health plan to establish the home care to establish who their preferred home care agency was, who their preferred risk groups were, or who their risk groups were managing the patients, and where their centers of excellence were in the community. So that when a wound, rather than that wound being sent to or given the option of the patient to find the appropriate care center, that patient would go to the most appropriate care level at the time the patient was identified as a wound care patient. So if they went to the center of excellence, the discharge orders would follow that patient because we would coordinate the care. We would forward those protocols to the home care agency so everyone was on the same page with those appropriate care protocols.
I don't want you to have the wrong impression. There are societies, many societies, wound-related, dermatologic-related, podiatric-related, that have established validated protocols that are available. But very often they're very complex.
That's my question. I mean, lots of protocols to me equates to no protocols. Complicated protocols to me
If you only had
equates
one- if
to
you only had one-
no
if
protocols.
you only had one, that
Here's
would-
what I want. I'm a simple-minded practitioner. I want to know what to do. And here's a wound. Maybe there's no physician really nearby in my community, and this person can't really travel very far. Here's a wound. Can you just give me some bullet points? Help me out here.
There-
And I'm not hearing that from you.
No, there are resources, there are meetings, there are journals, there are mentors that you can establish with. I teach in a school of podiatric medicine, and one of the tenets that I preach is find a mentor. If you don't know how to put on a total contact cast, find someone who does know and learn the technique. So those tools are out there. It's just a matter of those individuals wanting to have access to them.
Is that too simple? I caught a little no from you when he was talking.
Well, I mean, I'm back to what your thought is, where there are a lot of protocols, meaning there's not one you can really refer to. And we have this problem in orthopedic surgery in many, many, many conditions. And so there's regional variation in how it's treated. And until the literature supports strongly one specific way, the academy won't stand behind it and say, this is what we should be doing, and publish a real evidence-based guideline. And I think that's what we have here in wound management. There is no academy to drive towards a single accepted evidence-based
Well, not only that,
guideline.
but there's another problem as well. So when you're thinking in terms of orthopedic surgery, you're looking at orthopedic surgeons.
Right.
In this particular case, you're looking at a plethora of individuals from all different backgrounds, and they have their own philosophies as to how these wounds are treated.
And that was my point, precisely. You know what I'm looking for? I'm looking for the article, the New England Journal of Medical
Well,
article.
AHRQ publishes guidelines on pressure ulcer management. They've been doing it for quite a while. It has a complete set of protocols.
It does.
But are they implemented in practice? And who's accessing that information? How do you access it? In this day and age, it's not that difficult.
It's not hard. But are they getting access? No. They are?
In some instances, they are.
Sometimes yes, sometimes no.
Yes.
Which is true
Sometimes
for many
yes,
diseases.
Exactly correct. Exactly correct.